Ever wondered what post-traumatic stress disorder or PTSD really means? It's a term we often hear, especially in relation to our brave military personnel. But what does it truly entail? Post-traumatic stress disorder is a mental health condition that may develop following a traumatic event. This could be something one has experienced or witnessed. While it's often associated with combat veterans, it's important to remember that PTSD can affect anyone who has been through trauma. So what's it like to live with PTSD? Symptoms can range from flashbacks and nightmares to severe anxiety and emotional distress related to the traumatic event. Individuals may also exhibit avoidance behaviors, a negative shift in mood and thinking, and a heightened state of alertness, known as hypervigilance. But the reach of PTSD extends beyond the individual. It has a profound impact on their families, particularly in the context of military families. Imagine experiencing secondary trauma, feeling the anxiety and emotional turmoil of a loved one grappling with PTSD. Communication becomes a battlefield of its own, as emotional distance and mood swings lead to misunderstandings and strained relationships. Children are not left untouched. The unpredictable nature of a parent's PTSD symptoms can disrupt their routines and create emotional challenges. Family members may develop their own coping mechanisms, some of which may be unhealthy, to deal with the stress of living with someone with PTSD. This could lead to social isolation or even substance use. The unpredictability of PTSD symptoms may also prompt families to withdraw from social activities, leading to feelings of isolation and loneliness. Then there's caregiver stress. Family members often step into the role of caregivers, managing appointments, medications, and emotional support. This role can lead to burnout and emotional strain. And let's not forget the impact on relationships. Marital bonds can be tested by the challenges of dealing with PTSD, as intimacy, trust, and communication may falter. But while the impact of PTSD on military families can be significant, it's not insurmountable. Open communication, professional help, and learning about PTSD together as a family can foster understanding and empathy. Remember, there are resources available to help cope with these challenges. Seeking help and building a strong support network can make a positive difference in managing the effects of PTSD on both individuals and their families. In conclusion, PTSD is a mental health condition that affects not only the individuals who have it, but also their families. It's a journey filled with challenges, but with the right support and resources, it's a journey no one has to walk alone.